Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
We hear a lot about heart health for people, but dogs and cats suffer from heart disease too. Today, we're covering the warning signs every pet owner should know, as well as answering your other pet-related questions. On this episode of Ask the Doc, no appointment needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Joy Carter, a licensed doctor of veterinary medicine, and today we're focusing on cardiac care for our beloved pets, or as we like to say in the South, bless their little hearts. All right, guys, let's get started. Our first question comes to us from Theo, who just reached out to us through our website, allhealthtv.com. Dr. Joy, we're looking into getting a King Charles Cavalier Spaniel, but I heard that they're known for developing heart disease. Are there any screening tests that can be done? All right, Theo. I love King Charles Cavalier Spaniels. They're so stinking cute. All right. But unfortunately, they are one of, I would say, the number one breeds of dogs that do develop heart disease. They have a very big genetic component. Now, not every King Charles Cavalier Spaniel is going to develop heart disease, but it is quite a large percentage that they do. Now, as far as screening tests, okay, so the big thing is just bringing your pets in yearly for checkups and having the veterinarian obviously listen to their heart with a stethoscope. If they do hear something called a heart murmur, all right, then I would definitely, especially for that breed of dog, recommend further workup. So other tests that can be done, there is, I guess, something called pro-BNP. Okay. It is basically a biomarker. They have something similar to this in humans, but I'm not exactly sure what it is. Basically, whenever there is excessive stress or stretch on the heart or the cardiac muscles, this biomarker, the level increases. And this is something that you can measure in blood. And if you see elevated values, then that can indicate that you do have some heart disease and that the heart is not functioning as properly as it should. And so with those cases, then I do recommend more testing, such as chest radiographs, okay? And then the next thing would be an echocardiogram, which is an ultrasound of the heart, and also an EKG, which gives us the electrical rhythm of the heart. All right. So definitely, Theo, with this breed, okay, make sure yearly checkups. If any time a heart murmur or any signs that are concerning for heart disease are noted, obviously follow up with your veterinarian and then talk to them about the additional tests. But I definitely like the pro-BNP test because it's just a simple blood test, can be sent out to the lab. If I have a dog with a heart murmur who comes back with a pro-BNP that say is in the normal range, I typically will then just tend to monitor the pet. If it does come back elevated, then that's when I'm going to recommend more advanced testing, such as the echocardiogram. All right. All right, our next question comes to us from Eliana, who reached out through our Facebook page. Hola, Dr. Carter. Mi tia recently took her 3-year-old ragdoll cat in for a routine checkup, and the vet said he has a heart murmur and may need an echocardiogram. What exactly is a heart murmur? What does an echocardiogram look for, and could this be something serious? Hola, Eliana. All right, so let me address this question for you. So basically what a heart murmur is, same thing it is in humans, is kind of an abnormal or an extra sound that we hear when the heart is beating. A lot of times people will say it kind of sounds like a swooshing sound that can be heard. Now, it doesn't always indicate that there is active heart disease. It does indicate there is something going on within the heart, though, okay? But that doesn't always mean that it's so advanced that the pet is in heart failure or has what we call like cardiomyopathy. All right. Certain things that can cause heart murmurs, and there are different type of heart murmurs. Obviously, you guys don't need to know about this. Um, but certainly issues with their valves closing, such as their mitral valve or their tricuspid valve in the heart, that can certainly lead to a heart murmur. And that's typically the number one, thing that causes a pet to develop a heart murmur. Also, basically, if they have some type of defect in the heart, sometimes they can kind of have a hole in the chamber of their heart that can certainly cause a heart murmur. There are some congenital conditions such as patent ductus arteriosus. That is a mouthful, guys. That can cause a very specific type of murmur. I think we sometimes even say it's almost like a wash machine, like shoes in the dryer is a way we kind of describe how it sounds, okay? But just because your pet has a heart murmur does not mean that your pet is in heart failure or has basically cardiomyopathy or heart disease. It definitely does indicate that something is going on inside the heart, okay? And definitely that's why these other tests, like I spoke about in the last question, are so important, because those other tests let us know if there is something more to worry about with this heart murmur, or if it can be just kind of incidental. Particularly in cats, when you do hear a heart murmur in cat, that tends to mean that there is more likely to be something going on with the heart. Puppies and sometimes certain dogs can certainly have heart murmurs, as they are developing, that can go away. And sometimes even stress can even sometimes cause a heart murmur. Or I have seen in some pets, if they have severe anemia, certain medical conditions can sometimes cause a heart murmur that maybe is kind of incidental and is not anything too serious. So definitely tell your Tia to take her vet's advice, okay? With her cat being a rag doll, they are very predisposed to developing heart problems. So certainly if your vet here's a heart murmur, I definitely would recommend was following up with some of those screening tests that I mentioned to you guys in the last question. All right. All right. Let's go to our next question. Okay. And this one has come from Facebook, and this one is from Dante. All right. Or sorry, not Dante, Darnell. Excuse me, Darnell. Hello, Dr. Carter. I thought I was doing a good thing by feeding my dog a grain-free diet, but when I brought her in for her yearly checkup, the vet said that this diet can cause heart problems. Is that really true? Hi, Darnell. Thank you for sharing your story. And yes, this is 100% true. This is something that I would say since I came out of vet school, which I don't want to give my age away, but that was about 16 years ago, that we are starting to see. I do not remember learning about this in my cardiology rotation in vet school. So it is something that has come out within the last, I would say, probably maybe 10 years. Not exactly sure, but it is fairly new. There is something called basically grain-free cardiomyopathy. So what we are starting to see? We are starting to see in particular tends to be your medium to large breed dogs are starting to develop heart problems. And the thing they have in common is they were fed a grain-free diet. Now, I don't think we know exactly the whole mechanism behind it, what causes the heart disease, but all we know is that for some reason, these dogs who were on a grain-free diet had developed it, okay? Grain is not harmful to your dog, all right? It typically does not necessarily cause issues with allergies. It's a very important component of a dog's diet. So these grain-free diets that are marketed, a lot of this just comes from, I guess, human diets, and a lot of times humans wanting to decrease the amount of grain that they have in their food, but that's not necessarily good for our pets. So definitely, I recommend all owners to stay away from a grain-free diet. And if you have been feeding a grain-free diet, don't freak out too much, okay? I definitely would recommend finding another brand of food, all right? And maybe bringing your baby in for a checkup at the vet to, and see if they hear a heart murmur, or maybe do x-rays or anything like that, just to follow up and just tell your vet, hey, listen, I didn't know that grain-free was bad for my dog, but I'm worried and I want to make sure that my dog's heart is okay. All right. All right, guys, I am back. Okay, so our next question comes to us from Sophia, who just reached out to us on Instagram. Dr. Carter, my husband and I have a boxer, Iron Mike, that we adore. He's been pretty fatigued lately, and it looks like he's lost weight as well. Our neighbor who owns his pet store thinks it could be early signs of heart disease. What do you think? Hi, Sophia. Without examining Iron Mike, it's difficult for me to say, okay? But your neighbor could possibly be right. There is a condition, particularly in boxers, we call it boxer cardiomyopathy, or the medical term for it is going to be arrhythmogenic right ventricular cardiomyopathy. That is another mouthful. So basically, unfortunately, this type of heart disease can cause sudden arrhythmias in boxers. It can cause them to collapse suddenly, and it can cause sometimes sudden death. I have unfortunately heard stories of these dogs playing, running around, and next thing you know, they fall over and they're gone. Unfortunately, there's not much you can do if that situation happens, but definitely, if you do have a boxer, and especially if you are starting to notice that they are slowing down, or if you notice they have maybe an episode of some type of collapse or what we call like a syncope episode, you definitely need to take them into your veterinarian as soon as possible. Okay. Just like I talked about earlier about those screening tests, they're probably going to want to do some blood work, like maybe the proBNP, probably going to want to do EKG, chest x-rays, and then possibly, an echocardiogram. If they do have this condition or do have some arrhythmias, there are some medications and things like that that they can be put on, okay, to basically keep them from having these arrhythmias. But definitely this is something that can be 100% serious, since the fact that it can cause sudden collapse and sudden death. So definitely you want to get your pets, screened for that, especially if you do have this breed. All right. Good luck with Iron Mike. Hopefully that's not the case. Maybe it's just a little bit of old age, but you better be safe than sorry. So definitely take him in and get him checked out by your regular vet. Okay. All right. And this question is from Artie, who reached out to us through YouTube. All right, Artie. Doc Joy, as a long-time cat owner, I'd like to know if it's really true that cats with heart disease often go unnoticed longer than dogs. And if so, why? Do they have a higher tolerance for pain? All right, Artie, this is like a really awesome question. Yes. Unfortunately, cats are very good at hiding a lot of different types of diseases, and heart disease is one of them. All right. When it comes to dogs, typically with dogs, they do tend to be more active. They do tend to go outdoors. We take them for walks, things like that. So a lot of times we will notice symptoms earlier. In particular, one thing that you'll tend to see with dogs is going to be exercise intolerance. So slowing down, just not wanting to go for a walk as long as they did before, breathing really heavy after a short walk, things like that. And that's not something that a lot of times we can really evaluate in our cats. You can tell if they are being a little bit less active, but I would say most cats are not being walked. There are some owners who do walk their cats though, but most cats are not going outside for exercise. And so it's really hard to evaluate if they're kind of having exercise intolerance. Another thing that we tend to see in dogs that we don't see as much as in cats, when they have heart disease is going to be cough. Okay. Certainly we can see cats cough, but there are a lot of other conditions other than heart disease that can cause cats to cough, in particular feline asthma, hairballs, fur balls, things like that. But in dogs, a lot of time, a wet cough can be very indicative, or sometimes even a dry cough, because they may have an enlarged heart that's putting pressure on their trachea. That is another sign that we tend to see. I would say typically when we are concerned about heart disease in cats, or the signs that we tend to see, they're very nonspecific, which means there's a lot of other things that can cause these signs. Definitely lethargy, just not being as active, sleeping a lot more. And another one is decrease in appetite and weight loss. That is a really big thing that we tend to see. Now, another sign that we sometimes will see is sometimes increased respiratory rate, or increased respiratory effort. So using their abdominal muscles more, or sometimes taking very kind of quick, shallow breaths. in particular, in cats that tend to develop heart disease, they tend to develop a condition called pleural effusion. Okay. So basically, this is where you have fluid inside your chest. And what the problem with that is your lungs are not able to expand properly, and you're not able to get in enough oxygen and air into your lungs. Now, in dogs, you can see pleural effusion when they do have heart disease, but they tend to develop fluid within the lungs, and that's called pulmonary edema. So in those cases, those are the cases that you tend to hear this kind of wet cough. And certainly they can have also some breathing issues and things like that. So yes, unfortunately, already the signs of heart disease can be very hard to detect in cats. But the number one thing you can do, guys, is just bring your pet in for yearly checkups, okay? A lot of times there's things that you may not notice at home, but your vet may be able to pick up some things on physical exam. And definitely if there's a concern about your pet having a heart murmur or some type of heart disease, like I talked about before in the previous questions, there are some screening tests that can be done to find out, if it is something a little bit more serious. All right. All right, so we got another question from our website, and this is from allhealthtv.com. You guys should really go check it out when you get a chance because it is a choke full of great information. All right, and this question is from Rhea. All right, who asked? Hey, Doc, we got an adorable poodle mix who was recently diagnosed with heart disease. Our question is this: should pets with heart disease continue to exercise? All right, back guys. All right, let's get back to your question, Rhea. All right, so as far as pets with heart disease and exercising, so exercising is not necessarily bad. It can really depend on how advanced the heart disease is and what exactly heart condition they have. That is definitely something that a veterinarian or a cardiologist can kind of advise you a little bit more about. But just because your pet does have a heart murmur or could have very what we call like early stage, like heart disease, where they don't necessarily need to be on medication, just need to monitor things. There's nothing wrong necessarily with taking them out for a walk. I definitely do feel like you do need to kind of monitor your pets. And if you start to see that maybe they're breathing very heavy or seem to be kind of getting a little bit tired, then you may want to kind of cut the walk short. But there is certainly nothing wrong with exercising them. Now, definitely if your pet has got more severe advanced heart disease or is at risk of going into congestive heart failure, those are probably your dogs and your cats that you don't want them to be too active. Certainly they can go outside to use a restroom and be on a leash, but these are probably pets that you don't want to go around the block or, be running. But your best thing is to talk with your veterinarian, okay? They're going to be able to advise you, or the cardiologist or whoever you see as far as a specialist about their heart are going to be able to advise you as far as what exercise restrictions they should have. All right. All right. We got another question from our Facebook page, and this one is from Caitlin. Hi, Dr. Carter. My last cat, a Maine Coon, passed away from heart disease at the not so ripe age of 10. I think I'm ready to get another, but what breeds are genetically predisposed to heart disease? Hi, Caitlin. I'm so sorry about your last cat. But as far as breeds and cats that are predisposed to heart disease, okay, these are typically going to be any of your purebred cats, all right? Unfortunately, Maine Coon is a big one. Ragdoll is another one. Even Sphinx, your Persians, your British short hairs, all right? Any of those cats that you've got to go to the pet store and pay money to get, unfortunately, those are the ones that are predisposed. Now, certainly your domestic, what we call your domestic house cats, your domestic short hair, your domestic long hair, your domestic medium hair, they certainly can develop heart disease, but they are definitely less likely, all right? If you do decide that you do want one of those purebred cats, all right, definitely routine checkups. I definitely would recommend probably getting that pro-BNP test done yearly with annual blood work, especially as they start to get older. And that's the best thing that you can honestly do. Unfortunately, if they do develop heart disease later on, the good thing is we do have a lot of new medications and things out there that can help basically prolong their life. But unfortunately, sometimes these pets will pass away from that condition because there is only so much that you can do. All right. So good luck with finding another Maine Coon, but just make sure that you take him or her in for regular checkups so we can make sure that it doesn't develop any heart disease. Or if it is noted, that obviously you can, put your pet under treatment so we can extend their lifespan. All right. All right, guys. The next one in our queue comes to us from Otis on our Instagram page. All right. Doc Joy, we have a slightly overweight Dachshund, Gunther. Can excess weight have an adverse effect on a pet's heart health? All right. So the answer is yes, definitely. So excess weight puts extra strain on all the organ systems and all parts of the body, the heart included, especially if you do have a pet that has some type of heart disease. Being overweight, it's actually going to put a lot more stress on them. All right. Definitely recommend maintaining pets at a healthy weight. There's a lot of different things out there that can be done, especially if you do have a pet that is overweight, to obviously help them lose weight. We've got some new prescription diets. There's water treadmills. I mean, there's just good old getting them out, exercising, and then decreasing their food intake. But certainly your heart is a very important organ. All right. And the more overweight a pet is, the more stress and more strain it can put on the heart. So definitely that is something that you want to be very careful with. All right. So Otis, definitely, I know these Dachshunds, they are so stinking cute, and everybody loves a cute little chunky wiener dog, but is not going to be for the best of his health. So I definitely would recommend speaking with your veterinarian. If it's not a ton of extra weight that he has on him, then you may be able just to kind of increase his activity level and maybe decrease his food intake or decrease his treats. But if he is quite overweight, then definitely your veterinarian may recommend a prescription food to put him on. But remember, okay, you want your pets at a good weight because it's going to keep them healthy and it's going to keep them living a lot longer. All right. All right. And before we go to our next question, guys, let's go over some tips to raise a heart healthy pet. All right. So nutrient rich diet. So basically, when I say a nutrient-rich diet, you just wanted to feed them a very good quality dog food, okay? There are some cardiac diets out there, and those are more specific for dogs and cats who do have known heart disease or a heart condition they can be fed. Definitely omega-3s, fatty acids, things like that. Just in humans, they're good for our heart. They're the same thing in animals. A lot of the foods do have those in them, but certainly you can purchase those as supplements and add them onto your pet's diet. Just like we talked about with Otis's question, maintaining a healthy weight. Okay. This is not only good for the heart, but it's good for every part of the body. All right. And then physical activity. Okay. Same thing with us and humans, humans that tend to be more physically active, they tend to live longer, they tend to be at a healthier weight, which all these things kind of cascade down and can affect the heart. Another big one is going to be prevent parasites, in particular heartworms, guys, okay? We do see a lot of heartworms in a lot of the states that are warm most of the year round, okay, especially Florida, California, things like that. Texas is another big one. All right, heartworms, they're out there. They're spread by mosquitoes. All it takes is for one bite from an infected mosquito and your pet can get heartworms. It can be treated in dogs, but treatment is very expensive. In cats, there is no treatment, okay? So definitely I recommend having your pets on prevention. And the other thing is going to be good dental care, guys. Get those teeth clean, all right? Well, that's all the time we have for today, guys. But hopefully I gave you some good tips and answered your questions to keep your pets and their heart healthy. Bye, guys.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.